Republican support. The Senate passed a bill that calls for sweeping change in the health care system. Republican Senator Orrin Hatch of Utah has contended it just might wind up being the most widely hated legislation of the decade. And Senator Hatch is on Capitol Hill after that vote this morning. I talked to Senator Kirk, Ted Kennedy's replacement in the Senate, who described this as sweeping and historic. He said he was standing and then crossed the threshold of history. Do you see it the same way, as historic?
Well, I think the Democrats deserve some credit for being able to push through something like this. On the other hand, if you look at what it is, it's got to be concerning to every American citizen. Just think about it. You know, Social Security, when it passed, had huge bipartisan support. Medicare, Medicaid, huge bipartisan support. Civil rights, huge bipartisan support. This one had no bipartisan support, even though there was much. There were a number of things in it that we could have worked off of. We just weren't invited to be in the process, and they didn't listen to any of our ideas. And frankly, this is just step one. It's not passed yet, and it's got a long way to go.
Senator Hatch, how can you say that you weren't invited to be part of the process? There were Republicans working with Democrats hand in hand to try and mold this legislation, but every time Republicans would come say, for instance, we don't want the public option. The public option went out, and still no Republicans supported it. They talked about Medicare expansion. When that was taken out, still no Republicans would support it. Let me ask you, what's in this bill that you like?
Well, first of all, you weren't part of the process, so you didn't realize that they did the Help Committee bill, completely Democrat, didn't even ask one Republican opinion. The Pelosi bill, completely Democrat. The Reid bill was completely Democrat, all done with the White House. And even Democrats weren't invited into that meeting. Yes, Senator Baucus did try to get Republicans and did have a series of meetings, but he was so restricted by what they demanded to be in the bill that we really couldn't get anything done there.
And Olympia Snowe?
And Olympia Snowe was part of that, but she came to the conclusion that, frankly, they didn't really work with us. And like I say, there are things in this bill that we could work from, and we could do a lot of good on. But this bill is so partisan. This has $518 billion more in taxes. They're taking $500 billion out of Medicare at a time when Medicare is $38 trillion in unfunded liability. They're misusing the figures to make it look like they balanced the budget. They're doing things that they say they'll pay for that they can't pay for. You're talking about unconstitutional provisions. They're requiring, with this individual mandate, people to buy insurance that they may not want to buy. First time in history that's ever happened. And even under the Article 1, Section 8, the Commerce Clause of the Constitution, you don't get away with that.
And we've heard those criticism in the days and weeks and months leading up to this legislation passing out of the Senate this morning. You said that there are things that you could have worked off of. I'm curious, surely in a bill of this size, there are some provisions that you think, yes, if that had come up individually and not as a package deal with the rest of the health care reform legislation, I would have voted to support that. I'm asking you what those things are.
Well, there are a number of things there. Keep in mind, Contessa, almost every health care bill over the last 33 years has my name on it. And they were all bipartisan, by the way. A lot of them were with Senator Kennedy, Senator Dodd, Henry Waxman. You can go right on down the line.
Senator, do you like
Democrats.
The tax on tanning beds? Do you support this idea that insurance companies should not base their coverage on pre-existing conditions?
Yeah, we could have worked on the pre-existing condition. Could we all agree on that? We all agree on getting people to take good care of themselves and providing means whereby they can. I think we would agree on where we break down is we believe that we really ought to have the states much more involved, because every state has different demographics. Utah's not New York. New York's not Utah. But we have different problems than they do. They have different problems than we do. We would have worked it out on that basis, like I did on the CHIP bill. It was a Hatch-Kennedy bill. We had the states basically run the program, even though the federal government had something to do with it. We would have worked very closely with them had they worked on some of these provisions. And there are others in there that we could have worked on, but they didn't even come to us. And then what did they do? They bought the votes of a number of these people. $100 million to Nebraska, $300 million to Louisiana, $500 million to Massachusetts, $600 million to Vermont. When does it end? I mean, that's the kind of stuff. That's backroom politics of the worst sort. It's Chicago-type politics of the worst sort.
Senator Hatch, it's good of you to spend a few minutes with us on this Christmas Eve. Thank you, sir.
Nice to be with you.
Still ahead this hour, more on the case of a missing Utah mom. This morning, her husband's family speaks out. Do they think he's in